Good afternoon, everyone, and welcome to the latest government COVID-19 briefing. For those of you who are tuning in for the first time, and I doubt there are very few of you, the process is fairly straightforward. We introduce the members of the panel. Would like to introduce to you our interpreter, Ms. Carolyn Powell, and we allow questions and answers at a certain stage in the process. But we begin first with statements. Our panel this afternoon, starting with His Excellency the Governor Martin Roper, Premier the Honorable Eldon Mclaughlin, we have the Honorable Attorney General Samuel Bulgin, and of course the Minister of Health, the Honorable Joyne Seymour. Thank you all, gentlemen. All right, so we're going to begin first with the latest COVID-19 update. For that, let's turn to Chief Medical Officer Dr. John Lee. Dr. Lee?
Good afternoon. I'm reporting 15 results which have been done over the last 48 hours, the samples taken and assayed. One of the results of these 15 is from Health City. All of the results are negative. I also wanted to mention that I have received a copy of a press release from the Honduran government saying that the subject who we previously talked about, who's now unfortunately died, was negative for COVID-19. Please, can I remind everybody, it's absolutely vital, despite these negative results, that we keep our distance from people and keep your hands clean using either hand sanitizer or washing with soap and water.
Thank you, Dr. Lee. Let's turn things over next to Premier the Honorable Eldon Mclaughlin.
Thank you. Hello, everyone. Today I want to talk about Cayman's survival plan, which I have named simply Stay Home Cayman. I want to do so in the context of the current statistics, which show that there have now been 578,000 cases reported of COVID-19 and 26,477 deaths. The USA now has the dubious honor of having the most reported cases, 94,667, with 1,444 persons dead. Italy has 86,490 cases and 9,134 dead. In the UK, there are 14,543 cases and 759 deaths. I'm sure everyone has heard by now that Prime Minister Boris Johnson, as well as the Health Secretary, Matt Sandler, both have been tested and both have been confirmed as having COVID-19. Our regards and best wishes go to both of them. I should also add as an aside, my friend Prince Albert of Monaco has also been tested positive and is reported to be recovering from COVID-19. I say all of those things and provide those statistics to underline how critically important it is that we do everything we can to keep Cayman from joining the list of very, very worrying statistics. So far, we have 9 reported cases and 1 death. The death of the unfortunate man, or I should say, is a case, is an imported case. So thus far, there have been no persons who were resident here who have succumbed to the disease. And we still have very limited evidence of any community spread. That is a remarkable achievement. I'm not going to try to do the arithmetic in my head of how many cases we've now tested, but I'm sure we'll get to that before the end of this press briefing. But overall, it seems that our strategy so far is working. We have to do everything we can as a country and as a people to make sure that it continues to work and that we can have this wave of COVID-19 pass over us and come out the other side with very little in terms of casualties. So, as I said, our survival plan is stay home, Cayman. And that is what all of the measures, most of the measures that we have introduced are aimed at ensuring. The current curfew that is in place will end at 5 a.m. tomorrow morning. Cabinet has approved regulations this morning which will put in place what is officially called a shelter-in-place regime. I prefer to describe it as a soft curfew because the hard curfew, that is the one commencing at 7 p.m. and running through 5 a.m., will continue for the next few days as well. The soft curfew will begin at 1 minute past 5 tomorrow morning and run through until 7 o'clock tomorrow evening, and then the hard curfew will commence again. And that is going to be the way we live for certainly until next Friday. What does that mean? Under the hard curfew, almost all businesses are shut down. The one significant exception are restaurants who are providing delivery service and who are able to remain operational until 9 p.m. But beyond them, all other essential services, all businesses are closed. Gas stations, supermarkets, pharmacies, banks, all businesses. Come tomorrow morning, starting at 6 a.m., a number of other essential businesses will be allowed to open through to 6 p.m. They will be supermarkets, grocery stores, gas stations, banks. And healthcare facilities. All other businesses will remain closed, and all other employees other than essential employees of establishments which are regarded as essential are also to remain home. Everyone who is not an essential person, and the Attorney General will go through the list in due course. Any person who is not exempted from the provisions of the shelter in place or the soft curfew are still required to remain home unless they are going out on one of the permitted missions under the regulations. That is, to visit the supermarket once for the day, to visit a pharmacy, to visit the gas station, to visit a bank, to go on exercise within the permitted parameters, which means not more than 2 persons unless the other persons are members of your household. Other than that, you are required to remain at home. Once we get to 7 p.m., the hard curfew comes back into force, and all businesses are shut down again, except those restaurants who are providing delivery service, and that will then run through again until 5 a.m. on Sunday morning, when, again, the shelter-in-place provisions come back into force, and you can leave your premises for the limited purposes I just described. But the overall theme remains stay home, Cayman, unless you have a very good reason to go out and it is within the permitted provisions of the shelter-in-place order. I think I'll stop there and ask the Honorable Attorney General if he will now go through the regulations in some detail.
Thank you, Premier, and happy Friday to everyone. So, as the Premier said, there is no place for complacency at this stage. Cabinet approved some regulations this morning, and these regulations are made under the public health law and therefore have as its focus the prevention and control of the spread of the virus. I will give you a general overview of what they contain. But as the Premier said, the general position under the regulations is that gatherings, parties, and events such as conferences and concerts of more than 2 persons are not allowed. Further, commencing at 5:01 a.m. on Saturday, 28th of March, for a period of 10 days, there will be in effect, as he said, shelter-in-place order, which will apply to Grand Cayman, Cayman Brac, and Little Cayman. Of course, this period may be extended by Cabinet if it deems necessary. During this period, persons must remain in the confines of their premises, inclusive of their yard space. Failing to do so may result in a person being liable on conviction to a fine of $1,000 or to imprisonment for 6 months. While it is critical to limit the number of people out and about at any point in time, which the expert tells us is one of the best ways to prevent the spread of the virus, the government appreciates the need for some degree of continuity of services and operations across these islands. Accordingly, the regulations provide for a number of exceptions to the shelter-in-place requirement. These exceptions relate either to person or to activities. For the ease of reference, the exceptions have been broken down into various categories. So category A, that is, essential services providers are persons who are designated to carry out certain activities or duties only when acting in the course of their duties. And I emphasize that. So even though you fall into these exemptions, the exemptions only apply if you are performing your duty. So if you're a police officer and you're not on duty, it does not allow you to travel to and from West Bay during these hours. You must be traveling to or from your place of work or some other related activity. And that is quite important. So these are as follows. Police officers, Customs and Border Control officers, officers of the Fire Brigade and prison officers, persons involved in essential services delivery in the form of child protection and residential care, and who are in the Department of Children and Family Services, waste and sanitation workers, staff within the healthcare facility, or persons delivering emergency medical services, essential officers of any water, electricity, or other encompassing the provision of electronic communications, including print and electronic media. Persons employed to physically deliver water to premises. A person who provides care to a vulnerable person or a person with a disability. Persons who operate taxis for hire, provided that there are no more than 2 passengers in the taxi at any one time, so that each passenger is able to distance him or herself as far as possible from the other passenger and from the driver. Persons involved in agriculture and food production. Persons engaged in the delivery of propane cooking or cooking gas. Persons engaged in the provision of emergency veterinary services. Persons engaged in the exercise of cabinet, parliamentary, or judicial duties. Services connected with the loading and unloading of cargo ships and with the storage and delivery of goods. So there are those persons who, once the cargo have been offloaded, who are responsible, as I understand it, for transporting it to some establishment where it is put in cold storage and packed away. Those persons are exempted for obvious reasons. So, persons employed by a business licensed to provide security guard services, so licensed security guards. Persons employed by restaurants to provide food delivery services until no later than 9 p.m. Persons employed by businesses other than restaurants to provide food or grocery delivery services also until no later than 9 p.m. Persons who travel to restaurants which provide takeaway or curbside takeaway food service for purposes of collecting the food until no later than 6 p.m. Civil servants as designated by the portfolio of the civil service. Charities and other persons engaged in the delivery of food or groceries as designated by the competent authority. Again, there are some like Meals on Wheels and Feed Your Future and others who are operating in a similar arrangement who provide these valuable services. Persons who have to, there's a list also, exemption rather, for persons who have to undertake essential travel to any of the following facilities, and I emphasize essential travel. Healthcare facilities for emergency purposes, supermarkets, convenience stores, mini-marts, and pharmacies between the hours of 6 a.m. and 6 p.m. Again, I emphasize that it's essential travel. So it's not 6 trips to the supermarket for the day. Convenience stores and mini-marts will also be subject to the further restrictions of no more than 6 customers inside at any given time. And that's, of course, because of the sheer square footage of some of these places. There's also essential travel to retail banks, credit unions, and building societies between the hours of 9 a.m. and 1 p.m. So retail banks, credit unions, and building societies between the hours of 9 a.m. to 1 p.m. Persons visiting gas or refilling stations or such other places as may be specified by the competent authority, which, as you all know, is the Ministry of International Trade. Also exempt are members of an essential service or essential services provider, again designated by the competent authority. There is also a category of exemptions for persons who are exercising or walking their pet. So persons may also leave their places of abode or residence for no more than 1.5 hours per day to engage in exercise in public place or to walk their pet, provided that they maintain a distance of 6 feet or 2 meters from another person. The public is reminded, however, that even though exercise and pet walking are allowed, persons are still not allowed to go to public gyms or pools or these strata gyms. Category C, restrictions on other activities and operations. Activities such as having private parties, which include persons from outside the immediate household of the house occupant, and this includes parties held in and around private strata pool, and the hiring or traveling on a boat sailing inter-island other than for transporting of freight are not allowed. So no private parties around pools, charter pools, not allowed. However, persons involved in the following activities will be exempted from shelter-in-place requirements. Persons who have to perform urgent home plumbing, essential or roof repairs. For example, a plumber who is on an urgent call to do some work or electrical work, those persons are exempted, but it must be during their travel to and from answering these calls. That's when they're exempted. Persons who host or attend a wedding which has no more than 10 persons other than the bride, the bridegroom, official witnesses, and the marriage officer. And persons who host or attend a funeral which has no more than 10 members of the immediate family, 6 pallbearers, and at least 1 person who officiates at the funeral, as well as an essential mortuary staff. That's the allowance. So 10 members of the immediate family, 6 pallbearers, and at least 1 person who officiates, and the essential mortuary staff, as you call them, the undertakers. Right? So in conclusion, persons are reminded of the emphasis on social distancing, thereby maintaining a distance of at least 6 feet or 2 meters from any other persons, no matter where they are. It is only in so doing that we can reduce the further spread of this virus. Persons are also reminded that with the exception of those that are exempted, all establishments, institutions, businesses, organizations, and offices shall be closed. But if the employers so require, the employees shall work remotely from home. I would reiterate that supermarkets, convenience stores, mini-marts, pharmacies, and gas or refilling stations will now be restricted to conducting businesses during the hours of 6 a.m. to 6 p.m. Retail banks, credit unions, and building societies will restrict their hours of business to during the hours of 9 a.m. to 1 p.m. As a reminder to all persons employed within the public service, unless you are specifically designated as an essential worker and has to travel to or from work, you shall work remotely from home. The public is also reminded that during this time, for the purposes of ensuring persons abide with the shelter-in-place requirements, a police officer may require a person to answer any questions to enable the police officer to ascertain whether the person is and whether he or she is ascertain who the person is and whether he or she is an exempted person. This is understandable. Where the person does not satisfy the police officer that the person falls within the exempted categories, the police officer may direct the person to go immediately to their place of abode or residence. The police officer may also use reasonable force if necessary in the exercise of this power. However, it should not fall to the police alone to enforce the regulations. Indeed, the government expects that this will be largely an honor system, whereby persons appreciate the imperatives involved and act responsibly and exercise good judgment. Thank you.
Thank you, AG. A number of people have been messaging me while the Honorable Attorney General has been speaking. I guess some people joined the broadcast a bit late. Some people were not sure whether or not the AG was speaking to the shelter-in-place or soft curfew provisions or more broadly. So let me see if I can help. The current curfew provisions, which were introduced on Wednesday and which were extended since then and will terminate at 5 a.m. on Saturday morning is what I refer to as the hard curfew. But come 1 minute past 5 on Saturday morning, a regime which is termed in the regulations shelter in place, or what I describe as the soft curfew, will also come into effect to govern the daylight hours of life. The hard curfew will continue for the next few days until Friday next week, unless it's reviewed and shortened before that or extended. But on current plans, it will continue until next Friday. So every night, every evening, the hard curfew will come into effect at 7 p.m. and run to 5 a.m. During that time, it is essentially full lockdown as we are experiencing now, with only the most essential of services and personnel being allowed to operate. Many people have messaged me and my colleagues and said we should go into full lockdown for 14 days. Believe you me, if we thought that were practical, that's what we do, because it would provide the best results in terms of limiting people's contact with each other, and it would make the life of the police service that much easier because there are less people to monitor on the road. But no country in the world, not even China, has been able to do that, because people need the essentials, the basic essentials of life. And so that is why we have agreed to the shelter-in-place provisions, or the soft curfew during the daylight hours. The Attorney General has gone through in some detail the categories of businesses and the persons who will be exempted from the strict provisions of that, which are aimed at stay-home Cayman. But they also allow limited movement of people to carry out essential purposes or missions, to the supermarket, to the pharmacy, to the gas station, to the bank, to exercise back home. All businesses except those that have been designated as essential are closed, and all employees who are not designated as essential are all to stay home from work and are simply allowed out for the limited purposes that I just described. I hope that helps to clarify the distinction between the two. Again, all of this is aimed at keeping people as distant from each other as they possibly can, to reduce the chance of the transmission of the virus from one person to another. Even when people go out, they should not congregate in groups greater than 2 unless they are members of your household, of the same household. We know that this is going to pose some challenges, particularly tomorrow morning and during the day, as people, again, descend upon the supermarkets. What I want to say about that, which I was going to say for a little later, but as I'm speaking, let me say it now. There is no need to rush the supermarkets. There is more than adequate groceries and other supplies for everyone. If you can skip going to the supermarket tomorrow and can go on Monday, please do. The supermarkets have given us the comfort that they have adequate supplies, that they will restock their shelves, and there will be adequate provision for everyone for the foreseeable future. So there is no need for panic. There is no need for people to start to despair. We can get through this together for the next 10 days if everyone is reasonable and calm and willing to cooperate. The government does not want to be forced down the road of imposing another hard curfew where everything is locked down. We believe that given the results that we have, that we can quite safely operate within a soft curfew or shelter-in-place provision unless something happens that tells us that we need to move to some other regime. But if we make it, as a people, if we make it too difficult for the commissioner and his men to police this, if the commissioner comes and tells the governor and the cabinet that, listen, this can't work, we will be forced down the road of another hard curfew. So I beg again for the cooperation of the country. You have been absolutely exceptional over the course of the current curfew. Yesterday, I was evening, I was driven over the entire Grand Cayman from Northwest Point, Bosun Bay, all the way to Rum Point and back home. And quite frankly, I was so proud to be Caymanian, so proud of the way, generally as a people, we are respecting this and taking it seriously. We can do this together, Cayman. If there are questions, if people have concerns, please send them in. Let us try to help answer them so that everybody continues to cooperate. And so we can get to the end of this, call this a success, and then look at how we can start to bring Cayman back to operating in a way that most countries in the world are not able to do, with some sense of confidence that this evil virus is not still lurking somewhere among us. Thank you, Cayman.
Thank you very much. I first want to just say something about the curfew. This is working on the whole very well indeed. And again, huge thank you to the Police Commissioner and his officers. And the Police Commissioner can come up and say a little bit more in detail in a little while. But thank you also to the overwhelming majority of people out there who have responsibly observed this curfew. I was at Government House yesterday and looking out at the beach going in both directions, not a single person. And that makes me as Governor extremely proud that everybody is taking this very seriously. And I do want to reiterate a message the Attorney General made. Essential workers only have permission to be out if they are going to their place of work when they're on duty. If that is abused, we will clamp down on it very hard. So please do pay attention to that. The shelter-in-place policy coming in place tomorrow, it's effectively saying, please stay at home unless absolutely essential to go out, as has been set out. And if you have to go out, social distancing remains hugely important. We are trying to limit human contacts to the greatest extent possible. I share what's been said about tomorrow and going to the supermarkets. And please, please, please be responsible tomorrow. If you don't need to go, if it's not essential to go out to the supermarkets, then save it until Monday. Go later on. And we need everybody tomorrow to be responsible, and we can keep the shelters in place policy going. But if that isn't the case, we are going to have to consider going back to tougher measures. I just want to say a quick word on testing. I think, first of all, it's really positive what the Chief Medical Officer said again today. We have another set of tests which are all negative. So that, again, is hugely positive. We've also had good news on the equipment and supplies coming to Cayman to help us continue with the testing. And we have two different consignments coming. One of them, the Foreign Office has paid for and procured, which are being sent out to us now, and I hope that they are here within a week. But we are not concerned now that we will not be able to continue testing. And then finally, on a lighter note, the Premier yesterday mentioned the memes, Premier, and I think you all know I play the steel pan. Well, apparently I'm now in a band with everybody on this panel. So my advice to the Attorney General is be ready, Attorney General, because you will be in the band tomorrow.
Oh, Father.
Minister Seymour.
Good afternoon, all three of my beloved Cayman Islands, and I say that it's an opportunity for me to be clear that there's nothing between us other than sea and sand, and we'll get through this together, Cayman Brac and Little Cayman. Just a few weeks ago, the coronavirus was an issue at the fringes of our shores. Today, the world is in crisis, and the virus has made its own way into our community. As the latest figures by the World Health Organization, the globe has now reached, as you've heard, 500,000 cases, spread to 169 countries, and caused more than 24,000 deaths. There are so many families in all corners of the world in agony right now. Please don't let it be yours. There's a lot of charts floating around and new terms like flatten the curve and self-isolation. And as your Minister of Health, I thought it might be helpful to break down some of this for all of us. But first, we have to understand that pandemic is the concept of an exponential growth. This is the pattern viruses usually take, and clearly the path of COVID-19 is on, which simply means we won't count 1, 2, 3. We will count by the power of 10, 100, 1,000, etc. That stark reality is blinding. This is exactly why it's so important that we have to put in place these early intervention measures. Every time we as a community practice social distancing of 6 feet and staying home, we are saving lives. There are many countries, like Italy, who have shown us the dire results of not taking these actions. There's also other countries like Japan and Singapore, where we can see these very same measures working and the positive impact that they have made. The news around us tends to be all doom and gloom, but I urge you to take a moment to educate yourself on how these measures are working as well. It is important that we are all feeling empowered together. We are constantly gleaning insights about the controlling the viral pandemic. For example, China's extreme lockdown, which ended with almost 760 million being told to stay home and only to venture out for food or in seeking life and death medical help, has had very significant results. Since the time the lockdown began, the spread has dropped from thousands per day to just around a couple dozens per day. The extreme limitations on movement is clearly working. The World Health Organization has congratulated China on a unique and unprecedented public health response that reversed the escalating cases. The only thing China did wrong was wait. We will not wait when it comes to the matter of saving the lives of our own people. We, the Cayman Islands government, aim to be amongst the countries who changed the trajectory of the history of this virus. For us, this literally translates to staying at home, saving lives, to being 6 feet away. Such simple acts that make us all heroes, lifesavers, people who etch an unforgettable mark in history. I want to say, ladies and gentlemen, the virus doesn't move. People moves it. When we stop moving, the virus stops moving and the virus dies. Let's stay home. Also want to say that Miami-Dade is just planning a lockdown this week. And they are right next door to us. And we are way ahead of them. Kudos to the government. I want to say thank you to all the doctors and nurses and all the civil servant staff that are playing such a wonderful job. As I just spoke to the CEO of the HSA, they're out now visiting locations and buildings just in case this moves to another stage. I can tell you we are preparing ourselves for the worst and we're hoping for the best. I want us to always reflect that the Lord is my shepherd and I shall not want, the 23rd Psalm. He leads us in still waters and restoreth our soul. Yea, though I walk in the valley of shadow of death, I fear no evil, for thou art with me and will comfort me. Please be reminded. Thank you and God bless.
If those who see me on my phone, it's because the phone lights up every time I come here, and it's an opportunity for me to be able to address questions that people have via this medium as well. So 2 points. We didn't mention, or I didn't, neither did the AG directly, liquor stores. But liquor stores will be open as usual, well, within the hours 6 a.m. to 6 p.m. as our supermarkets and other stores. First point. The other point, which is a really sore point for many people here, and I really am sorry, terribly sorry about this, but it is impossible for the commissioner and his team to be able to police the sea properly, given all of the other requirements. Hence, no fishing, hence, no in-water activity with boats and so forth. If you go for a walk on the beach for your exercise and you take a swim, that's fine, as long as the numbers are very small, 2, unless it's your household. But no in-water activity by boats, no fishing, no jet skis, none of the above. And I'd be terribly sorry about this, but it really is a capacity issue, and the police simply do not have the wherewithal to be able to properly police these waters and do the job they need to do here, policing on land. So please don't beat us up too badly. It's not that we want to make your life any more difficult than it already is. It's just that we want to try to keep everybody as safe as possible. And unfortunately, not everybody is responsible, and we can't risk parties and big groups going out on the water where we are not in a position to be able to police it properly.
So just as
Police Commissioner.
Mr. Commissioner? I'm not even sure that's an actual title.
We'll take it. Good afternoon and thank you. So again, very pleased today to report almost total compliance with the curfew order, and just some stats to help everybody understand what we're doing. Little Cayman, no issues arising of any type. Cayman Brack, 94 police interceptions between 6 a.m. yesterday morning and 6 a.m. this morning, and only 8 persons found to be in breach. I don't say only 8 lightly, but 8 persons found not to be operating as essential services. Grand Cayman, 270 police interceptions over that 24-hour period, 15 breaches of the curfew detected, 4 arrests effected. So it's an almost total compliance, and I think, as Premier said, absolute great credit to the community for working with the police service, and indeed the supporting us in our efforts, Cayman Islands government and the police service in our efforts to keep the island safe and contain the COVID-19 infection. A little bit more statistics then. So looking at the statistics from 6 a.m. this morning to 12 midday today, 400 interceptions by police across the islands. That's a lot of utility working, moving across the islands, and 7 persons warned for breach of curfew, so 7 detections. So that means that 393 people were lawfully on the road in the performance of their duties. So overall, very, very pleased with the curfew. And I ask for your continued cooperation over the next period as we get through this, and I think tomorrow will be a busy day for the whole lot of us.
Yes.
So some of the questions that are coming in are being asked by multiple folks.
May I address another big issue?
You might save some questions that way.
Thank you. So questions are coming in about employees of essential essential services or businesses which will be open, the banks, the supermarket. The supermarkets are okay because they're on the nighttime curfew exemptions already. So we've worked through with them their issues. So we don't have an issue with them now. But banks aren't. And there will be some other stores that aren't in the overall curfew. So those businesses who fall or individuals who fall within the exemptions that the learned Attorney General listed, you still need to write to curfewtime@gov.ky with the list of the essential personnel that you need to have employed. Not everybody in your business is an essential employee for the present emergency purposes. So please don't send us a list of all your employees as some businesses have done. It just makes life that much more difficult for all of us. Look at your personnel, look at what services you are planning to provide over this limited period, and give us the skeleton crew.
So just before getting to some of the press questions, to follow up on that, we've got a couple of these a couple times, so I think it bears clarification. Things like, can an essential worker leave a child with a family member before coming to work? You may have touched on that, but the idea being that if I have to work, I would need to put my child in some kind of care, so maybe a family member. That would involve crossing households, hence the question.
Well, it's generally a bad idea for all of the reasons we've talked about, because you don't know where those people you're taking the child to have been, who they've been in contact with. So every time you do that outside your household, you're increasing the risk. The commissioner is not likely to put anyone in jail for doing that, but I'm saying we really should try to avoid doing that.
And another, again, you've touched on, but for the purposes of clarity, I know the Premier, and I'm just reading the person's question for them. I know the Premier mentioned healthcare facilities, but they just wanted confirmation that that included physiotherapy offices, labs, X-ray, private healthcare facilities between 6 a.m. and 6 p.m.
Yes, but only if you absolutely have to.
So it sounds like, just to, and you clarify if I'm incorrect, what we're saying is please use some common sense. Don't work if you don't have to work. If it's not critical, don't do it. It doesn't mean that your entity might not fall under some of the exemption categories, but still don't go open up and do business if you don't have to.
Absolutely.
That saves at least 4 questions. Reshma?
I just want to say also, because, we're up here, we've been at it a couple of days now trying to, and we won't get everything right, and we won't have everything on the list. If there's someone out there or a group of people that have a real concern of how it's going to affect them, please email curfew time so that we can take this into consideration and look at it again in caucus and cabinet and decide whether we think it's something that we should do. Because we're not up here saying that we got it all right, but the main thing is to try to get as much people off the road as possible for this duration, so that by the time next Friday comes, we can have the CMO up here saying no new cases reported, no one calling the flu line, so that we can relax more of these curfew restrictions.
Ms. Reshma?
Thank you. Good afternoon, everyone. This question came in for the Attorney General, just for ending up in another meme. But just to clarify, I know the Premier talked about this, fishing, it's not allowed. But what about the fishermen who already have stocks and may need to sell it? Would they be allowed to go out tomorrow to sell whatever stocks they may have in their freezers?
The simple answer is that if they are not mentioned in this list of exemptions, and they have no exemptions from the competent authority, then they are not exempted.
Thank you. I hope that helps that person. In terms of the
let me say this, though. We've created under the regulations a competent authority, which for the purposes of the regulations is the Ministry of International Trade. In real terms, that means Eric Bush and his team. So if there is a case to be made, the last thing we want to do is make people's lives any harder than it already is. We understand that. If there is a case to be made, contact Eric's team through curfew time at gov.ky and let us see whether we can assist without increasing the risks that we are trying to minimize by virtue of all of this. Because the competent authority has the ability to exempt individuals for a limited time, for a period of time, for however we need to do it to be able to make this workable. I know I'm taking a big risk by saying that because we're not inviting huge amounts of unreasonable requests, and we've had some of the most crazy requests that you could possibly think of for exemptions. Please don't overburden the system by doing that. But in the case of the Fisher people, please do that. So let us see if we can get your current stock. Don't go fishing anymore. Current stock of or your current catch into the hands of the supermarkets or someone else that will buy them.
Okay, thank you, Premier. Since we have you on the mic, the restrictions list, the shelters in place list is now out. There's a significant number of businesses that are not allowed to open tomorrow. What sort of feedback have you been getting from the business community in terms of cooperation, and what sort of plans do you have to assist those businesses who will be severely impacted by these closures?
Well, I would just have to go over all the things that we have gone through before. We are in the emergency stage. Unless you are starving or your electricity is being cut off or you can't survive, don't burden us with those issues now. We are trying to save the country from a massive health threat. We are in the suppression stage. I repeat for the 5th or 6th time, nobody's going to get their electricity turned off. Nobody's going to get their house foreclosed. Nobody's going to get the water turned off. We just need to get through this next few weeks, next couple of weeks. And then we can start to think about how we save businesses. If we wind up with a national emergency where the virus is ripping through this community, killing people by the hundreds, I promise you the last thing anybody's going to be thinking about is how they save their business. They're going to be thinking about how they save their lives. We are trying to avoid that.
I appreciate that, and I have to ask because it's being asked of us, so it's not that I'm repeating questions.
But the government, let me repeat, the government's focus now is saving lives, not saving businesses.
Fair enough.
Mr. Premier, just briefly, it may seem like a complete change of tone, but my phone is blowing up as yours is. There's a question about the senior citizens hour at the supermarkets, as well as whether the grocery stores will be open on Sunday.
A number of the supermarkets, and I don't want to call names because I might get it wrong. I've just seen, I think all of them have now put out flyers saying what their hours of operation are going to be, and I know certainly at least one of them has restricted the period between 7 o'clock and 9 o'clock for essential service workers and the elderly. So some of them are taking particular measures with respect to those. No, the supermarkets will not be open on Sunday.
Ashman?
Thank you. This question is for the Governor. You talked about 2 consignments that are coming in. Can you share some details on those consignments that we will be getting? What exactly will be in those consignments?
I mean, I haven't got the exact details of what's in them, but John Lee, our medical officer, I'm sure could provide that. But the first one I mentioned was that the Foreign Office, the UK Foreign Office, has been procuring for all the overseas territories, and that is now completed. And the orders that went in from each overseas territory are now being sent out by air freight to the overseas territories. So we will be getting an order of the materials that we need to continue testing. And I heard from HSA this morning there is another order sourced by HSA coming via the US, which is also completed and coming our way.
This is a good opportunity as well, I'll come back to you in a second, Reshma, to remind people that a lot of the questions that are being asked, as well as the regulations and other information, are going to be, if not already, available at gov.ky/coronavirus. And even for those of you who may not have access to it, at Radio Cayman will certainly be reiterating the key messages throughout the day and this evening and throughout the weekend to assist with that. So just remember, there's a lot of information on there, and some of your questions will be answered there.
Okay, thank you. The governor mentioned that probably Dr. Lee can assist us with the consignment, if he can.
I'm sorry, Reshma, I don't have much more information than the governor has to offer. I know that one of the consignments was, if the one comes through from the States, I mean, until they arrive, we don't know they're here, but if the one comes through from the States, it will enable us to test, I think, around another 500 tests, so that's a good consignment. The one from the UK, I don't know the exact quantity they're sending, but they're slated to be here shortly, I mean, within days rather than weeks.
Okay, Dr. Lee. So yesterday we talked about the remaining tests being 100. You've conducted 15 today. How are those supplies running? Will we have to put a pause on testing until these consignments arrive, or what's the game plan in the interim?
We wouldn't put a pause on them because we would just continue to test as per the protocols, but they would be sent to CARFA for analysis rather than be done locally.
Okay. Thank you.
Mr. Morales, just a moment. From CNS, how is the situation on test kits arriving for HSA? Yeah, I wasn't sure if you covered it. And then what kinds of numbers is the hospital seeing of people who may think they have COVID-19 symptoms? What kind of intake are you getting?
I'm sorry, I don't think there's anyone here from the
Oh, Dr. Rodriguez.
Yeah. Dr. Williams would probably be able to answer that question better about the numbers of people coming forward to the flu clinic.
Like, I could have bought that. Yeah.
Hi, good afternoon. Yeah, the flu clinic started on the 16th of March. It was quite busy on the first day, but the number have been going down, and up to this week, the number have been actually quite low. This is good. That means the persons are using more the flu hotline, also following the government advice to stay home.
Just to add to that, just to give some raw numbers in terms of some of the calls to the flu hotline, we had over the past couple of days before yesterday, we normally would receive about 120 calls per day from the flu clinic, and yesterday it went down all the way to 41. So that's good news.
Mr. Morales?
Kevin Morales, Dr. Lee, if you don't mind, can I trouble you for a couple more? Sorry, you're getting your exercise in today. Just to start out with, can you give us an update on the numbers, the number of tests, I guess, total right now, as best you know?
I'm looking at my file, which is over there. Yeah, so the total number of samples we've tested to date are 190. The total negative has risen to 181. All of the other results that we've previously given are unchanged. Those numbers will be updated on the website within about an hour of the conclusion of this. So with the other positives are 8. We still have 1 that's inconclusive that is being treated as if it is local, but we're still awaiting a formal report on that one.
Okay, and that was my next question for you about the inconclusive case. Do we know when?
We would be waiting for that to come back from CARFA, and
yeah.
we know that takes a little while. I haven't. I believe it went off in consignment a couple of days ago.
Can you give us an update on just the overall health and status of the 8 confirmed cases, and even really the 9th patient who is inconclusive? How are they feeling?
I have no reports, and I would get them, so I'm not trying to hide something here, that they're at all unwell. In fact, I understand that most of them are relatively well or better, so they're certainly not going in the other direction. Yeah.
Okay, That's great to hear. Thank you very much.
I think some of them are totally asymptomatic at the minute. Yeah. So
Wonderful. Thank you. My next question is for Governor Roper. Just an update on the air bridge that we had talked a little bit about yesterday, and specifically, we talked about the challenges with flying supplies in. The BA flight in particular, is that, even when Cayman's airports open up, does that still remain, I guess, contingent on the Bahamas airport opening up as well, or is there some other route that could be used to get here? Just curious about how we could get creative with getting there.
We are working very hard on that, and I hope we will be able to arrange a flight. There's also Bermuda are involved in this as well, because there are a number of Bermudans in the UK who need to get back to Bermuda. So at the moment we are thinking of a UK Bermuda Grand Cayman flight, and of course that flight, if we can get it agreed, could bring in some of this this PPE kit if the other avenues don't work, and other things. So we've also, from the travel hotline, had contact from quite a lot of people who, if there was a way to get back to the UK, would want to take advantage of that. So we are hopeful that that can be arranged, and I'm in touch with the UK government in terms of how we might support. But at the moment there is nothing definite. It's still a plan which we're working hard to put in place.
Okay. Thank you very much. And my final question is for Premier Mclaughlin. Mr. Premier, you have said several times this week that we're concentrating on making sure that this virus does not spread, and we're not thinking about, the implications on business, et cetera. In your mind, when do you think it is appropriate to start thinking about that next phase? When will you be comfortable saying, okay, we've contained this as best we can, now let's move on to that next phase of thinking?
Don't ever believe that I and my government are not thinking about the economic things. I'm just saying we are not in a position now to really address those sorts of questions, because that's not the principal focus. And I'm trying not to distract the staff that we have with having to deal with those issues or ourselves. The key issue must be this. I know not everyone doesn't share my view about this. I mean, not even in other countries, the principal one of which shall remain nameless. But if we do not suppress the virus, all the rest of it is really for naught. Right? So that is our principal focus. I wish I could give you a definitive response as to when we're absolutely certain. I can't. I don't even know that our medical people can tell us. It's going to become a question, though, if we go on for a number of weeks with no new cases, we're going to have to make some assessments about how we can relax and get back to some sense of normalcy, because life itself is a risk. It's a question of weighing them up. But right now, the risk is still very, very grave. Us sending home or closing schools 2 weeks ago, we believe, and our experts believe, has made a huge difference in what could have been. So we closed the airports. We've done a lot of things much earlier than any other country has done, which I think is in large part responsible for the so far, reasonably good result that we have. But we are not out of the woods by any means, and we all must continue to practice social distancing. We must comply with the curfew and with the shelter-in-place provisions, and give ourselves every chance as a people and as a country to not have to endure the consequences of rampant spread of this virus through the community.
Thank you. If I could get one last one in for the Attorney General, and then that'll be it for me. Mr. Bulgin, you had described one of the professions, I believe, was caretakers for the elderly. Does that extend also to domestic helpers for families as well?
No.
It does not. Okay, just wanted to clarify that.
No, unless they live. What we're saying to people, and it's not always possible, and here's the reason. No matter how dear that person is to you, and I'll give you my own personal example. My helper has been with me for 27 years. She started with us when my eldest son was 3 months old. She was there long before my second one was born. She is like a mother, not just to my children, but to me. But she can't come to my house now because I don't know who she has been around or who she's with. And what will happen if I get knocked down with this virus?
Thank you.
What?
I'm trying to get people to be real about the consequences. It doesn't matter how close the person is to you. You know, Prince Charles has it, Prince Albert of Monaco. Nobody's immune. Mm-hmm. You got to keep your distance from people. As far as that is possible, keep your circle of people that you are in close contact with as small as you possibly can.
And sorry, Premier. And it is a real question that you ask, and a lot of people are asking about it, because we know that there's a huge population in this country that depend on their nanny. We have a lot of people working at home while they're still trying to rear their child. In a normal situation, persons would be at work and their child would be cared for or would be at school. So I know there's added burden. What was being suggested is if you have a trusted nanny who has been vetted and shows no signs, to have that person kind of, if possible, and if you had the space to live in for the next couple of days, if they could, so that they're not out in the community mixing with other persons and not knowing what they would bring back into the house. So we're not trying we're actually trying to help people save themselves.
Thank you very much.
So there is a question that I believe Dr. Lee may or Dr. Rodriguez may have answered, but I just want to make sure that that's clear. Of the 8 positive cases, how many are considered to have recovered? Dr. Lee says he'll need to check on it. He'll give us that information when he has it. A question, and I'm guessing this one is for the Premier, perhaps. This one is from Facebook. It says, where in the public accounts will the monies be sourced to support work permit holders? Will this be a loan, such as a crisis loan offered by the UK government? And do we have reserve funds set aside for residents, PR status holders, and born Caymanians in the event of hardship should they face it? As a result of this particular crisis, by the way, not in general.
So we are treating this as a humanitarian crisis. This is not a case for people to be given loans to bail them out of some situation or not. Regardless of whether you're a Caymanian or not, if you are stuck here with us for the duration, we are going to ensure that you can eat, that you have a decent place, a roof over your head, and that you have access to health care and to food. So anyone who finds themselves in a position where none of one or other or none of those needs are being met, we've said make an application to the Department of Children and Family Services through the NAU, which is the Needs Assessment Unit. Let us assess your situation and let us see how we can help. Doesn't matter whether you're Caymanian or not, you still have to eat, live, and breathe. We're all humans. And I know we've taken some licks for this, me in particular, but we have a duty. We have a duty to make sure that everybody who lives here is able to get through this time. And that's what the government is going to do.
One more question, this one, not really question, comment actually from a member of the public. In reference to what the Premier is talking about, I believe it would be best to do a soft curfew for 3 to 4 days to allow persons to shop and stock up and go into full lockdown. That way, on both sides, people have the time to do what they need to do, but also limit community transmission in the long run. Just wanted to pass that along.
Thank you. Thank you.
Noted.
Are there any other questions from the press?
If possible, for the Commissioner.
Sure.
Thank you, Commissioner. Earlier today, we had an incident that happened and there was a loss of life. There have been a number of questions that have come in surrounding this incident. And of course, there has been a video that is being circulated in relation to this incident. And a number of people are seen in that video as well during curfew hours. I just want to give you an opportunity to address that and if you can provide any further information in relation to that incident.
So I suppose the best way I can address it is we are at the preliminary stages of the investigation into a fatal traffic accident that occurred this morning in the Newlands area at around 10:30 a.m. It's a single vehicle collision, one person deceased. There was a video circulating, or it is circulating, I've seen it, and I suppose I've received comments myself. It's shocking that the video is circulating, and I'm sure distressing for the family of the deceased and indeed his friends. So I do have some concerns around that, and I know a number of people went out onto the public roadway at the scene and were having this debate as to whether they were rendering medical assistance. So it's something I will have to investigate. I don't believe I can say much more about the accident at the minute. It's tragic that it occurred. Maybe just some community confidence. It does appear that the male that was driving was responding to what he understood to be a medical emergency involving a member of his family.
Thank you very much, Commissioner. In terms of people who are out on the roads, who have the authority to be out on the road, is there any, advice, warning, any sort of suggestion that you may pass on to them? We have clear roads, there's no traffic, so when there are clear roads, you know what happens. Is there anything that you would like to say to the public who are traversing the roads during these curfew hours?
Well, it's the same public message. You must drive carefully and you must drive safely at all times. The road infrastructure doesn't facilitate speed. You should not be speeding. Drive within the speed limits, drive carefully, drive safely. If you're not supposed to be on the road, please do not be on the road, particularly during the hours of curfew.
Thank you. If I may, can I ask the Governor a question quickly?
We're going to wrap up in just a couple of moments.
Yeah.
If you could.
Governor, today you toured the HSA lab facilities where the testing is being done. Can you tell us what you've seen there? What are some of the impressions that you've had during your visit at that lab?
I mean, I paid a brief visit there this morning simply to thank the staff and to ensure I understand the process myself. I mean, I think the main message is that I think we can have confidence in our testing system. It's proven to be robust. Public Health England have reaffirmed that. PAHO, the America's World Health Organization regional body, has approved it. It was impressive to see this in operation. And we are still the only overseas territory that can do testing on island to the quality that is being done here in the island. So we should be very proud of all the people who are involved in that.
Thank you.
So, Mr. Lewis?
Yes, good evening. This question is for the Premier. If anyone knows me, they know I was brought up in a Christian family. So these two questions are relating to faith. We have a question from a reader regarding church. Church is open on Sunday.
Well, the answer is no, because we've restricted gatherings to 2 persons.
Okay, yes.
But that doesn't mean that churches can't be open online or on Facebook, as many of them have. It just means you can't gather together in a physical building or room for the purposes of worship.
Okay. And the second question is, do you plan to have a National Day of Prayer? Or would you be willing to bring in a pastor, someone to lead us in a short prayer at one of these briefings? As we know, the community is minded, like-minded.
So again, we're restricting gatherings to 2 persons. So that sort of prevents the usual National Day of Prayer, the way that we normally do it. But we can certainly do it over social media or over the radio or over television or all of the above.
Okay.
But congregations, even those of churches, are not allowed in this time that we're in.
Okay. Thank you.
Yeah. Thank you. I would invite a pastor if the premier would allow me. I guess I've been the person who has been doing the prayers, and I haven't run out of prayers, but but I think we could take someone well trained come up and give us give the nation some calm.
Thank you very much.
Yeah.
So that will wrap up the proceedings for today, with the exception of...
Sorry. Just to say that I have attempted to give an overview of the regulations, but I would urge persons to read the regulations for themselves so that they can be familiar with it. Okay? Just don't take my summary as exhaustive.
And as we mentioned before, if you go to gov.ky/coronavirus, you'll be able to see the regulations as well as a number of other bits of information that you can find useful. Some of you have sent questions through 17, it feels like, different social media platforms. If I miss anything, I will certainly make sure that gets passed on to the appropriate parties, as well as provide the opportunity for it to be updated on the gov.ky website. One more thing to mention as well, we will be having a press briefing or COVID-19 briefing tomorrow at 2 o'clock, so please tune in for that. Thank you, everyone.